Warm greetings, everyone. Thank you so very much for joining us today. I'm pleased to welcome you to this important webinar on TB prevention and care among refugees and other populations in humanitarian settings. The webinar is co-organized by the World Health Organization. We have two departments working together, the Global Tuberculosis Program and the Department on and Cluster Emergencies. Um, we are co-hosting with the United Nations High Commissioner for Refugees, UNHCR, and the Centers for Disease Control and Prevention, CDC. I'm Hannah Monica Diaz from the WHO Global Tuberculosis Program. I lead the work on the DG flagship initiative, Find, Treat All, NTB, TB elimination, and the building of public-private partnerships. I'm joined here by my director, Dr. Teresa Kasaeva, a director of the Global TB Program, Rudy Connings from the WHO Emergencies Department, and other colleagues from both departments here. So to start off, tuberculosis remains one of the leading infectious disease killers, the second top after COVID-19. It causes millions to fall ill and lose their lives annually. Refugees and other populations in humanitarian settings face substantial threats to health and survival, such as poverty, crowded living conditions, undernutrition, and poor access to health services, all conditions in which tuberculosis thrives. The COVID-19 pandemic, combined with situations of conflict and crisis, such as those that we're seeing brewing right now across Eastern Europe, Africa, and the Middle East, makes it even more important, now more than ever, that we reach individuals, communities, and populations hardest hit to alleviate the suffering that they are facing. At this special event, we will be launching an interagency field guide on TB prevention and care among refugees and other populations in humanitarian settings. This is a culmination of work across all three agencies. We've consulted extensively with our offices at regional and country level. We've sought inputs from partners in civil society. This event will provide an overview of the interagency field guide, its plans for rollout, as well as ongoing efforts and opportunities to combat TB in humanitarian settings. As you can see, we have a very distinguished lineup of speakers today. Many thanks for all these speakers who've made time, including WHO Assistant Director Generals, Dr. Ibrahima Sosei-Fall and Dr. Ren Mingui, Mr. Sajid Malik, Director, Division of Resilience and Solutions, Office of UNHCR, and Hank Tomlinson, Director, Division of Global HIV and TB at the U.S. Centers for Disease Control and Prevention. They will officially launch the Interagency Guide. We will open this webinar hearing from a refugee and TB survivor from Somalia who's now based in Kenya, Hibo Mohammed. She will share her story to put in stark perspective for us why this work that we're doing is so important and it's going to be so crucial looking ahead. We will then have we will have the official launch of the document, as I mentioned. This will be followed by a panel discussion where we will hear from a country, DRC. We have with us Dr. Michelle Kaswa, National TB Program Director from Democratic Republic of Congo. We have Ann Burton from UNHCR, Kevin Clark from CDC, along with Susan Maloney. We have Rudy Connings from WHO Emergencies, and from WHO Civil Society Task Force, we have Paran Sarimita Venarni, who will be providing civil society perspectives. And we're pleased to have Dr. Teresa Kasaeva, who is sitting beside me, who will close the event. To open, let's go straight on to the opening where we will hear from Hibo Mohammed about her personal experience fighting drug-resistant TB during the refugee crisis. Give us a few minutes, please. Technical difficulties.
waan xanuunsaday waan qandhaday ambaana xanuunsanaa isbitaalkaa la keenay meel booskaa liiga soo seexiyey waarkaa la seexiyey 14 beri aan ku jiray 14 beri markaan ku jiray maxaa la iga qaaday canjuufta maxaa la dhahay moostii waa laga helaa TB saasay igu bilaabeen 7 beri aan ku qaadanayo waarka meesha aan jiifay waan ku reestay marka ruux xanuunsan ahaa oo garabka la qabanayo masqusha la gelinayo oo wasaa u dhib qabo oo dhiig la'aan waxaa lagu daaweeyey xaar dheera 6 bilood ay siiyeen ani iyo wiilkeyga 6 bilood ay siiyeen hooyaday ayaa waday meeshaa lagu karantiilay ciddaa la soo baaraa la dheh ciddii hooyo iyaa la baaray waa laga waayey wiilkii iyo ani unbaa lana siiyey daawada TB-da wiilkii yar aad baan ula kulmay ninkana wuu nacay waama kala tagnay jirada ugu nacay wadahdee waa camuurowsan ruux TB qaatay marka faariid dhinac asaga hadda markaan xeer joogo hargab ugu dhaco dhag waa way xanuuni waa inaan kaniinyo cunaa qaxootiga waa markaa imaaday ninkana uu igu nacay alxamdulillaah aabbahay ay qaatay adeegana meesha dhibaatooyinka waa dhibka i haysta Soomaa waa jiraday waa xanuunsanaa wax waan qabsan waaye cida reebaha iska kor saaran hadaba inta ma cuni waaye jalba ma cuneenin ruux filimba lagu xiraayo isbitaal ku jira ahaa waa iska laqaay tabcaan ku gaaray oo kulliite saayada dhulka ay dhigtay daawada 4 bilood dhulka igu siisay 2 bilood kale uma reesto aanaha مثل هلا مرقة وحاس أديهم جروب يرفضوا فلسطين TB ده وهم بكسرنا الحمد لله وحلا وعذر صغنا ولا داوين كرا داوي ده أفضت الداوي سني منقدي وعفمات دود هاي
So we'd like to express our thanks to Hibo Mohammed for sharing her story, and also our thanks to UNHCR for helping source this this personal story that really forms the foundation of all the work that we're doing here today. So without further ado, we'd like to move now to towards the official launch of this interagency field guide. As I said, we have a distinguished lineup of high-level representatives from across 3 agencies, and we'd like to invite them to showcase their commitment and support. So to start with, I'd like to invite Dr. Ibrahima Sosefal. He is Assistant Director General Emergency Response at WHO's Health Emergencies Program. So, Dr. Sose, over to you, please.
Thank you, Monica, Teresa, and Rudy, and colleagues in the main room, distinguished colleagues, partners, and friends. On behalf of the World Health Organization Emergency Program, it's my pleasure to join this special webinar along with my colleagues from WHO Global TB Program, UNHCR, and CDC to officially launch the Emergency Field Guide on TB prevention and WHO and the Health Emergency Program in particular is committed to protecting people from health emergencies in humanitarian settings, and that include preventing tuberculosis and taking care of TB patients. This guide could not have come more timely as we see an influx of hundreds of thousands of refugees from Ukraine into Poland and other neighboring countries. Unfortunately, we are facing many more humanitarian emergencies from Cox's Bazar in Bangladesh to Yemen, from Colombia to Libya, and the actions outlined in this guide will help healthcare workers to provide effective TB prevention and care services to the people we routinely care for in emergencies. WHO is committed to supporting the rollout of the director in close collaboration with all our partners and our country offices. It is our collaborative responsibility to ensure that people in humanitarian settings have access to essential care services, including TB prevention and care. We are committed to put this into practice. Please join me in rolling out the guidance document and make it available to all humanitarian workers dealing with refugees and other populations so that together we can end TB.
Thank you so much, Dr. Socio. Very much appreciated. We request you to hold on. As soon as we finish our statements of support, we will have a photo opportunity for the official launch. So thank you for kicking off the launch. We'll now turn to UNHCR, Mr. Sajjad Malik, Director, Division of Resilience and Solutions, Office of the United Nations High Commissioner for Refugees. Over to you, Mr. Malik.
Thank you very much, Monica, and really appreciate that the work that is being done to bring this guide today to the launch here. We are very pleased and greatly welcome this initiative and our partnership with WHO, CDC, and many other stakeholders in this initiative. So most welcome to have these guidelines being issued today. As Dr. Socio has already highlighted, we really very pleased to see the progress made on inclusion of refugees into national TB programs. And we have many good examples. Dr. Socio has highlighted already in his very brief intervention there, but most refugee hosting countries already making efforts to access TB treatment for refugees to the national TB programs through drugs, through financing, through many other ways that we are making sure that refugees are included at the national TB programs. In terms of inclusion, we can already see progress has been made, and we wish to extend our thanks to all refugee hosting countries. Those who have included, those who are making efforts to make sure refugees are included in national TB programs. In testing, in treatment, in social support, we see the targets are being achieved so far, but we also feel that it's been challenged that to achieve the 2025 or 2030 targets, we need to continue making sure that forcibly displaced population, refugees, and the others, IDPs, are included in these efforts. Otherwise, it will be extremely hard and difficult to achieve the targets that are set there for them. There are challenges, I would say, despite the fact that the good progress has been made. We heard from Hiba Muhammad how she felt when she was diagnosed for TB, and not only just the challenges and trauma that she had to face, but also the social structure around that. Livelihoods are lost, jobs are lost. The resources that are required to have this treatment are enormous burden on an already very stretched situation that refugees face. So it's very important that the consequences of TB and the effects on life that is there it's beyond the direct impact that happens on an individual, but it's also the family and the communities around that. So we need to continue supporting them in a much broader way, as we have also included in the TV programs. But we also see challenges that are seen in the disruption in TV services due to COVID-19. I think we need to very much keep that in perspective. The field guide will definitely help us a lot. It's very timely to bring TV program back on track globally as we are beginning to tackle the whole impact of COVID-19. As we work with national TV programs and partners in implementing the guide, we just need to highlight again, and we keep on emphasizing that we reiterate our full support, and we want to make sure that going forward together on the national TV programs, together with WHO, CDC, but also engaging communities, refugee communities, IDP communities, NGOs who are working with us, and many, many stakeholders. We're looking forward to implementing this guideline and making sure that the programming, for TV programming for some of the most vulnerable population is going to bring a huge change in their lives. So congratulations to all our staff, colleagues, partners who have worked on it, and we're looking forward to taking this forward from here. Back to you, Monica.
Thank you so much, Mr. Malik, for the commitment you have expressed and for sharing key perspectives from the agency, from UNHCR. Thank you for your support. I'll now turn to Dr. Hank Tomlinson, Director, Division of Global HIV and TB, U.S. Centers for Disease Control and Prevention. Over to you, Hank, for your statement.
Thank you, Monica. Thanks, Teresa, and to everyone at WHO who has been such an important partner and for hosting this webinar. Thanks also to Hibo for telling and sharing her story with us and clearly impressing upon us the importance of this continued work. It's my pleasure to be with you all this afternoon and to join this webinar to officially launch the Interagency Field Guide on TB prevention and care among refugees and other populations in humanitarian settings. This manual, co-developed by the U.S. Centers for Disease Control and Prevention, CDC, the World Health Organization, and UNHCR, replaces the 2007 Interagency Field Guide and contains substantial changes, including new strategic approaches, guidance, and innovations for TB prevention and care interventions in humanitarian settings. CDC has a longstanding commitment to helping those affected by emergencies and to strengthening public health systems in and after humanitarian crises or population displacement. CDC also plays a key leadership role in global TB efforts to promote high-impact research and innovations in TB program service delivery. The Interagency Field Guide provides a framework and specific steps that can be taken by emergency preparedness professionals, humanitarian organizations, and national TB programs to prevent TB illness and deaths among refugees and other populations in humanitarian settings. We recognize the urgent need to deliver life-saving TB prevention and care services to these vulnerable groups and are committed to supporting ministries of health, WHO, UNHCR, humanitarian organizations, and civil society in implementing updated and innovative approaches to delivering patient-centered TB interventions. Through our CDC country offices and our technical experts here in Atlanta, we will continue to support these valued partnerships toward actions outlined in the Interagency Guide. And reaching global TB goals in humanitarian settings requires strong collaboration and a common approach between emergency response, national TB programs, and sustainable development stakeholders. We hope this guide will provide a useful and actionable roadmap towards this goal. Indeed, together we are stronger, and only together will we end TB. Thank you.
Thank you so much, Hank, for your positive message of support. Yeah, so very inspiring. We'll now come back again to WHO. We are very pleased to have with us our Assistant Director General for WHO Assistant Director General, Dr. Ren Mingui. He is ADG for Universal Health Coverage, Communicable and Non-Communicable Diseases. Over to you, Dr. Ren.
Thank you, Monica. Distinguished colleagues, partners, and friends, on behalf of the World Health Organization and Division of Universal Health Coverage, Communicable Non-Communicable Disease Division. I'm very pleased to join this special webinar to officially launch the Interagency Field Guide on TB prevention and care among refugees and other populations in humanitarian settings, alongside my WHO colleagues, Dr. Ibrahima Socio and Dr. Malik from UNHCR and Dr. Tomlinson from US CDC. WHO is committed to accelerating the universal access to care and leave no one behind, including those in humanitarian settings. This guide will play very important and pivotal roles in enabling this. The key actions outlined in this guide that call for preparing and delivering effective TB prevention and care services for refugees and other populations during the humanitarian emergency needs to be urgently translated into the action and integrated fully within the coherent emergency preparedness, planning, and response efforts. In the face of COVID-19 pandemic and linked challenges, we need to redouble our efforts to make this happen. WHO is committed to supporting the rollout of this guide through this network of regional and country office in collaboration with partners such as UNHCR and the US CDC and the civil societies. We at the collective has an ethical obligation to continue to protect and ensure the refugees and people living in the humanitarian settings are able to access to TB prevention and care services that allow them to survive and thrive. Together, we are stronger. Together, we will end TB. Thank you very much, Monica.
Thank you very much, Dr. Ren. Very inspiring. And now, so we're very excited, all of us, that the Interagency Field Guide on TB prevention and care among refugees and other humanitarian populations has been officially launched by WHO, by the leadership from WHO, from UNHCR and CDC. So congratulations to us all, and also many thanks to all of you who've joined us. We have nearly 140 participants connected here today. So what we'd like to do now is to do a quick photo opportunity with the leadership from the three agencies. If your background hasn't been changed, it would be good if you could hold up a printout if you have it, and we will spotlight you, all four of you, and the team. So maybe we'll first take a quick picture with Dr. Ren, Dr. Socio, Mr. Malik, and Dr. Tomlinson. So first, maybe we can quickly do that. Okay, perfect. And now we'd like to invite all the broader team. So it's been actually quite a collective. I read out who the panelists are already. So if all the panelists, we also have members of the Interagency Writing Committee here. We have Dr. Pier Paolo Colombani, we have Susan Cookson, and other colleagues who are part also there. So we'll take a quick photo along with the leadership of the three agencies as well. Okay, so we have that, and thank you. Many thanks to the high-level leadership who's joined us. Thank you, Dr. Socio, Dr. Ren, Mr. Malik, and Dr. Tomlinson. We very much appreciate your leadership and commitment. This is what's going to be quite critical as we drive forward with this guide and, translate it to action so that it can reach those in need on the ground. So thank you very much for your continued commitment and support, because we will be depending heavily on you when it comes to rollout. So as I said, we have nearly 140 participants connected. Thank you for joining us, and we'd like to take this opportunity to know who you are as well. So we can't have right now, of course, a picture, but we'd like to know who you are, where you're from, and I'd like to ask my colleague Wong Yi if you could quickly share a Slido poll. So we invite you to use your phones or go on www.slido.com. Give us one quick second. Voila. So you can use your phone, go on the camera setting. You can click on the QR code. It will take you to Slido, or you can go on slido.com and type in hashtag Refugee 2022. And so if we can, what we'd like to know from you is, please add your name and your country. So I'm going to quickly post my own, so you can take a look. So so you can see I put myself down. Monica from Switzerland. I'm from India originally, but I put down Switzerland. Wonderful. Thank you, colleagues, for posting. We have IBK from Kyrgyzstan, Angelica from Paraguay, Paran from Indonesia, UK. Wow, this is amazing. So we have people from across the world. I see people from Indonesia, people from UK, from Jordan, Nevin Wilson, Thailand. And thank you, colleagues, for joining us, because we know that very often it's so difficult to get a suitable time slot where we can, cut across all 6 regions. And it's great that we have people from Paraguay to Indonesia, to the US, to Bangladesh, to Spain. Wow, this is amazing. Thank you for your support, and thank you for joining us. We'll keep this poll open. If you're interested in being part of the launch, and you'd like to post this on social media and also share with us, what we'd like you to do, and I'll ask my colleague to share, is you can take a selfie. So if my colleague Anna or E can share how you can do this, we are going to post in the chat for all of you a link where you can download the Zoom background that you see that each of the panelists have. You can use this Zoom background to put it yourself. You will have to do it after this meeting, so you can use it, and you can take a picture, or you can open up the cover of the field guide on your phone and use this as to take a selfie. So my colleague will show you in just a moment. Okay, my colleague from Moscow, Anna Stukalova, will kindly share. Anna? So we have, for instance, we have our director, Dr. Kasaiva, with the picture of the cover that Anna just showed you. So we'll put so for all of you, we will put it on the chat. So please feel free to access, and please send us your photos. We will send to you our email which is gtbprogram@who.int. Please do share with us these pictures. So we will post in the chat how you can, quick steps on how you can connect. Send us your selfies, please, so that we can promote as widely as possible on social media. All right, so now let's move ahead. Now that we have this officially launched, we'd like to give you a quick introduction into what the guide is. We'll give you a quick snapshot of what it is, what the key elements of the interagency field guide is, and yeah, we'd very much like to hear your inputs. So please give me a second while I open this up. Okay, so as you can see here, yeah, this is the cover of the interagency field guide. So just to give a bit of background about why addressing TB in refugees is so critical, you've already heard from all three agencies why this is so imperative. So just very briefly touching back upon it, to give you a glimpse into what statistics really look like. So the 1951 Refugee Convention states that refugees should have access to health services. They should not be left behind. And the number of refugees, tragically, has been increasing in recent years. Right now, the number of refugees in total is 26.4 million. The total number of forcibly displaced populations is at 82.4 million. And unfortunately, with the current situation in the world, this is set to go higher, very sadly. Tuberculosis imposes immense human suffering and loss. It remains, as I said, the second top infectious killer. 10 million people fall ill annually, and there were 1.5 million deaths in 2020. The COVID-19 pandemic has severely impacted the TB response and progress. For the first time last year, we reported that TB deaths increased in over a decade, and progress has overall been set back by several years, by nearly a decade, due to COVID-19. TB particularly affects poor and vulnerable populations. Refugees and internally displaced persons are at increased risk of developing TB and of poor access to TB services. Comorbidities, poor health and nutritional status can also weaken the immune system and make people more vulnerable to developing TB. And this is the situation, as you know well, in acute emergencies. All these are major issues, as well as increased risk of treatment interruption or access to diagnostic and care or support services, and delays in access to TB treatment in arrival in the country of asylum. Access to TB services may be further compromised due to costs or lack of access to national services. So this remains a sad reality for refugees who are already burdened and who also have to face infectious diseases like tuberculosis. So what factors put TB at risk? Congested and poor living conditions, of course, compromised, combined with poor health, nutritional status, as I said, during the acute phase of refugee displacement may increase the chance of infection and disease. Loss to follow-up, this may include difficulty in tracking those people who already have TB among new populations continuing their treatments, handling issues around transmission, access to medicines, again, is quite a big challenge. And more recently, of course, the COVID-19 pandemic has overall exacerbated the situation for the general TB situation, but even more so for refugees and people in other humanitarian crises. So we have several commitments in place. So this is a bit of good news. The world has come together, leaders have come together to make these strong commitments to address both the refugee crisis as well as this massive crisis on TB. So in 2016, the United Nations General Assembly adopted the New York Declaration for Refugees and Migrants, a very landmark declaration which sets out commitments, including on essential healthcare to enhance protection of both refugees and migrants. For TB, we had heads of state come together at the first ever UN high-level meeting on TB in 2018, where commitments were made to close gaps in accessing care, increase investment, make sure we reach everyone with TB preventive treatment, address issues around human rights and stigma. Very, very comprehensive declaration on TB, also underlining very clearly that a vulnerable population such as refugees should not be left behind, and that they should be able to access prevention and care services and should be a core target for us all. This was followed in 2020 by a special progress report from the UN Secretary General, Antonio Guterres, outlining 10 priority recommendations, and again putting the spotlight on what's needed to really accelerate to reach the targets set in the political declaration, the targets for 2022, and to end TB by 2030. So this has been quite important, and which also, of course, mentions vulnerable populations like refugees. And before that, of course, we have a whole range of commitments that drive all of this action, notably the Sustainable Development Goals, WHO's End TB strategy, the Moscow Declaration on TB, TB elimination framework, and the notably the WHO Director General's Find, Treat, All NTB joint initiative that puts a spotlight on reaching each and everybody with TB prevention and care in line with WHO's overall push for universal health coverage and health for all, to make sure no one is left behind. So going into the interagency field guide after that bit of context setting. So this guide, as I said, is a joint effort of UNHCR, CDC, and WHO. It includes new strategic approaches, guidance and innovations for TB prevention and care interventions in humanitarian settings. So this basically brings together all of our latest key guidance. It focuses primarily on managerial and organizational aspects of TB interventions and provides links to the most updated guidelines for clinical aspects. It can serve as a useful tool in humanitarian settings to alleviate the suffering and deaths caused by this preventable and curable disease. So especially over the past 5 years, we've seen significant developments with new guidelines on drug-resistant TB, on TB prevention. We are looking at having shorter treatment regimens. For instance, we have new rapid diagnostic tests. No longer is it the microscope. The first recommended test is using Gene Expert, and you heard that in the video that you saw from Hibo Mohammed, that UNHCR shared. So many developments, and all of this guidance so far has not been consolidated. And here under this guide, we brought everything together. So it's a very handy tool for people in the field to basically access, to figure out, what to do when they meet people with TB and how to handle different issues. And there are case studies and practical examples sprinkled throughout the document to showcase how different countries in different settings have done this. Thank you. So there are three main and complementary audiences for this guide. persons leading, managing, and technically supporting overall emergency preparedness and response in any country or setting, including those overseeing and delivering health services, people leading, managing, technically supporting the implementation of national TB programs. So we want them engaged as well in any country. People engaged in the design, delivery, and or monitoring of services provided to displaced populations and surrounding communities that are affected by complex humanitarian emergencies. So these are the three main target audiences for this guide. But of course, that's just a starting point. There's so much more, health workers across different levels, community supporters, volunteers, young people engaged. The list goes on, but this is the core. So the guide has a couple of main sections. So there's one section on addressing TB within emergency preparedness, and it addresses the nature of basically it looks at preparedness, national emergency planning, and how TB concerns can be tackled. It introduces how national TB strategic plans can be strengthened to enable better in-depth planning in advance. And it offers overall guidance and tools, across various things like engagement, even communication, advocacy, and communication that can be useful both for overall national planning and national and operational planning. And it really focuses on integrating efforts into overall preparedness. So we're not looking at any, standalone sort of effort just on TB and refugees. We're talking about integrating everything into the overall effort that's being led in the country to help people in humanitarian settings. So just underlining that. The next section, which is really core, is on TB prevention and care in emergency response. So as many of you know, the initial phase of a humanitarian emergency is often characterized by extreme hardships, deprivation, which later stabilizes when basic needs are met and mortality and morbidity rates decrease. TB emergency interventions can be classified into, basically, what is the minimum priority actions that you can undertake for immediate response, and then, a more comprehensive response as things stabilize and there is more capacity. So what we've done in this guide is we've really taken key aspects along the pathway of TB prevention, diagnosis, care, and we've kind of pulled out the recommendations and put them down for, what do you do in the immediate response, when you need to do an immediate response, what are the minimum priority actions that need to be undertaken, and then also highlighted what can be done in the comprehensive response. And we also highlight what are the key resources, including operational guides. So of course, there's only a summary or quick tables of recommendations that are put in the guide, but there are links which, if someone is interested in learning more or going in deeper, they can do that as well. There's monitoring and evaluation, including key indicators, as well as partner and role allocation in emergencies. We also then have a whole section of annexes with key resources and templates. So yeah, so that in a snapshot, very quickly, was the Interagency field guide. We will put the link to the field guide in the chat. Please do browse through it. Share with us if you have any questions. We would welcome that. And I'd like to highlight here that the document was prepared by an interagency writing group, and you can see here we have Pier Paolo Colombani, Ann Burton, Kevin Clark, Rudy Connings, Alison Hoskins, Alan Gidraff Maina, Susan Maloney, Susan Cookson, Diana Weil, myself, and of course the overall guidance of my director, Dr. Teresa Kasaeva, and also the directors of the other agencies. So sincere thanks. We have a bigger list of acknowledgements in the field guide, where we acknowledge all our dear colleagues from different from headquarters, from regional and country offices across both WHO, UNHCR, CDC, and partners who have provided inputs. Our deep thanks to you, and we look forward to working with you all in rolling out this guide. So I've just put down here the theme for World TB Day, which comes on 24th March. Invest to end TB, save lives. So this is something that we need to do as well when we look at reaching those in humanitarian settings. So, dear colleagues, thank you for your patience in hearing that quick overview. Please do feel free to post any questions you may have in the Q&A function on Zoom. Please use that for any questions. We'd now like to move quickly to our interactive panel. As I said at the start, we have a distinguished lineup of panelists. This session is going to be held in an interactive format, where we will, have a Q&A style discussion with each panelist to hear from them. How they think, what are the opportunities, what are the challenges in operationalizing the interagency field guide, and how can we ensure access to life-saving TB prevention and care services for refugees and other populations in humanitarian crisis settings. So that's going to be the format that we do it with, but we would welcome your questions throughout this panel discussion using the Zoom Q&A. So to start with, I'd like to invite Dr. Michelle Kaswa, National TB Program DRC. So this panel has Dr. Kaswa. We also have Dr. Ann Burton, Dr. Kevin Clark, Dr. Rudy Connings, and Paran Sarimita Vinarni. So can we start with Dr. Kaswa? Dr. Kaswa, can you please turn your video on?
Oh, sorry, maybe you cannot see me, but you can hear me. Can you hear me?
Yes, we can hear you. Thank you, Dr. Kaswa.
Okay.
So we will share your presentation. Yes, we understand there are connection difficulties in these virtual times. So let's quickly load your presentation. And Dr. Kaswa, we'd very much like to hear from you as Director of the National Tuberculosis Program in the Democratic Republic of Congo, about what your experiences have been in addressing TB in, in displaced populations and among refugees. What do you see were the key challenges and responsibilities? Give us a second as we load your presentation.
Okay, Monica.
Okay, go ahead, Dr. Kaswa.
Thank you, Monica. Thank you to WHO for giving us this opportunity to share this experience. I guess what is important to notice for DRC, when we are talking about these refugees issues, we need to give more clearly, to explain three concepts. The first one, you can go to the next, please. Next slide, please. Okay. Next, please. Yes, just this one is the introduction to say that we have neighboring country, so you can easily understand that if there is instability, not only in your country, but also in your neighbor, you will suffer for this kind of problem. And during the last decade, the history of DRC has been rich with civil unrest, army conflict. So these this lead to a massive population displacement and with overcrowding living condition, and in humanitarian crisis, poor access to TB prevention and care, and even for TB cases detected, often they have no adherence to the treatment. Next. So in DRC, according to the UN, at least 5.6 million of people are displaced in DRC, including 2.7 million between January and November 2021. You have three different, as I was saying, that we have three different concepts. You have the first concept, we can call it the refugee. The refugees from neighboring countries, like Central Republic of Africa, Rwanda, Burundi, South Sudan. So you have also displaced population. So leaving some trouble from rebels, ADF, Codeco, and you have the third one, what we call the repressed population, usually coming from neighboring country like Angola. Slide, please. And this is, I give you just two examples of hotspots in security region is Ituri. And in Ituri, you have 36 health districts, and you will see that 24 are actually in trouble. So it's a big issue, and we organized there some TB services, and last 3 years, we detect something like 1,800 TB cases. Next. And I was talking about, next please. I was talking about this replaced population from Angola coming with poor conditions, living conditions. So, and also we detect also TB cases. For your question, Monica, I can say, what are the key interventions that we implement? Next, we implement in these migrant camps. Next, please. So, using a multi-sectoral approach, putting around the table the country, WHO, the OIM, CSR, UNHCR, we implement a contingency plan, organize awareness session for the refugee in the camps. We pass the message through the various local channels like radio, churches, school, public place. We actively search for patients. We have interrupted their treatment and also for suspected TB patients. Also, we organize the management of TB services in camp with the assistance of healthcare workers identified among them. Also, Monica was talking about monitoring and evaluation. And you need to be sure that you make information collection, validation, and monitoring transmission to available. Next. What are the key challenges? Well, here I'm just showing that, as you say before, we need to work together and using this kind of integration of efforts into a more comprehensive and holistic response in this specific situation. So you have government, you have UNHCR, you have this kind of NGO, you have WWF Food Organization. So together then we can provide a more comprehensive and holistic response. Next. I'm presenting now the main challenges where we have to be faced during this kind of situation. So the intensification of attacks does not allow to ensure the regular care, prevention, and monitoring of TB case, and stability of the health district staff, and also the healthcare worker who fled the attack. Insufficient resources cover all affected health districts, as well as all humanitarian sites. The reducing number of community healthcare workers supported and involved in this response, and the delay in reporting data due to the instability of the nursing staff. That are mainly the challenges, and I guess the opportunity is to work together and to integrate our efforts to get, slide next please, to get this comprehensive and holistic approach. I'll show you to end my presentation just what is the benefit. We need this kind of guide. It's important to organize the key element of the TB prevention and care in humanitarian setting to be sure that we can ensure access to TB prevention and care services and to interrupt TB transmission. Leave no one behind. I guess this is very, very important for us. I guess the last one, please. Thank you for giving us the opportunity to share our experience. If we need to end TB, I think we need now to think to our working out of the box. Thanks again.
Thank you so much for that, Dr. Kasfa. Very clear presentation, straight from the heart, from the country, highlighting what different approaches that you're using, the different innovations, the key challenges that you're facing, and how you're overcoming it. And you rightly pointed out, there's a need for all hands on deck. It has to be a multi-sectoral approach with accountability. So thank you very much for that comprehensive presentation. We're very happy to start off with hearing from a country first, so that that again gives us perspective on what's needed on the ground. Our focus is to operationalize this and get it on the ground as soon as possible. I'd now like to turn, thank you, Dr. Kasfa. I'd now like to turn to Dr. Anne Burton, who is one of the co-leads in the development of this guide from UNHCR. So Anne, thank you for joining us. And it would be good to hear from you. What do you see from the UNHCR perspective? What's the role of UNHCR and opportunities to roll out this guide to enable access to TB prevention and care for refugees and other populations in humanitarian settings? Over to you, Anne.
Thank you very much, Monica, and greetings to all of the other panelists and to all of those that have been able to join us today. Thank you for the question. The field guide provides a wealth of information on how national TB programs, humanitarian program managers, frontline health staff, and others can take steps to improve the response to TB programming in humanitarian contexts. I would like to highlight a few areas that UNHCR will be particularly focusing on. Firstly, is the continued inclusion of refugees in national TB programs and in funding grants such as the Global Fund. The vast majority of refugee hosting countries do include refugees in their national TB programs. So they're registered in the National TB Register, they receive drugs, access to diagnostics, and as well as supervisory visits. Progress has also been made on including refugees into TB Global Fund grants. So where we have new onset refugee emergencies, particularly in low to low middle income countries, we advocate for flexible approaches for the reallocation of resources provided to national governments by the Global Fund, and where necessary, providing governments with additional resources to meet the needs of a new refugee influx. But what are the policy and strategic approaches at national level that will help to achieve this? So firstly is greater consideration for TB in national emergency preparedness plans. This is not to say that TB should be a standalone item, but that the health consequences are reflected, that measures are considered for people that are already on treatment, and that consideration is given to the impact on TB risk of overly crowded congregate settings. At the same time, we encourage governments to consider and include the potential responses to emergencies within national TB strategic plans. So that is that the flexibility and adaptability required to respond to sudden increased needs is reflected. The third area relates to data on TB outcomes and notification rates. We will continue to advocate for and work with national TB programs for disaggregation of data by refugee or at a minimum nationality. Only then will we know whether the notification rates are in line with expected or that the TB outcomes are satisfactory. The fourth area is consideration of the socio-economic barriers. Refugees are often poor and marginalized, and even when they're employed, this is often in the informal sector. We have seen how TB is both a disease of the poor, but is also a cause of impoverishment. So though refugees are well integrated into national TB programs, they are not well integrated into national social protection schemes. So the manual outlines a range of measures to promote household food security and link with self-reliance. This is to already existing mechanisms and not standalone for persons with TB. So this is another area that we want to work with governments and partners on. And then lastly is the rapid scale up of TB interventions in emergency situations. So while TB programming is not the first to be put in place, for example, for new arrival refugees in the country of asylum, it is critical to put in place measures to identify those that are on treatment and ensure that they can continue their treatment. This is something that we are seeing with the Ukraine situation as people are displaced both internally, but also into surrounding countries. So the most important thing at this stage is to continue treatment for those that are already on treatment. And then once the situation stabilizes, start to scale up TB programming in conjunction with and in support of the National TB Program. So in summary, UNHCR will be looking at a range of areas showing the multi-sectoral nature of a TB response, all of which contribute to improving outcomes for people with TB, their families and communities. Thank you very much.
Thank you so much, and very clear actions on the role of UNHCR and how we can and collaborate to make this work. So thank you so much for that. It's incredibly very comprehensive and very clear. I'll now turn to my colleague and another co-lead along, Kevin Clark from CDC, also with Susan Maloney. But Kevin, as panelist, over to you now. We'd be very interested in hearing from you on CDC's role. What do you see as CDC's role, and what are the key opportunities that CDC would lead to enable access to TB prevention and care services for refugees and other populations in humanitarian settings? Over to you, Kevin.
Great, thank you, Monica. First and foremost, as a public health professional and pediatrician, I'm just thrilled to be with you all today and to be a part of this incredible global solidarity toward a common goal of ending the TB epidemic. And really, it's been an honor working with distinguished colleagues on this panel, on the numerous external reviewers, and really all of you participating today and on the important work ahead before us. Most importantly, we are driven by the experiences faced by refugees and persons in humanitarian settings themselves. At CDC, we recognize that although TB burden varies by local context, populations in crisis face common risks for TB transmission that warrant early and increasingly comprehensive approaches toward TB prevention, detection, care, and treatment. Through our CDC country offices and technical experts at CDC headquarters in Atlanta, we will continue to work through these valued partnerships towards continued strengthening of interventions outlined in the Interagency Guide launched today. CDC works alongside ministries of health and partners in more than 25 countries to find, cure, and prevent TB. Our efforts focus on strengthening national TB strategies and programs in priority countries with high rates of TB, drug-resistant TB, and TB-HIV co-infection. We also work closely with refugee resettlement partners to expand TB diagnosis and treatment capacity. CDC values playing a key role in conducting and disseminating high-impact operations research to promote innovation in TB program delivery and in our critical peer-to-peer partnership with host ministries of health. In 2019, in partnership with UNHCR and 2 national TB programs, we had the opportunity to survey refugees residing in urban settings, as well as local healthcare workers, to understand the barriers and enablers in accessing TB services. We observed that despite the adoption of critically important inclusive health policies, experiencing barriers to accessing TB services was common, but importantly, modifiable. The Interagency Field Guide provides a defined framework and approach towards not only delivering a person-centered minimum TB public health response, but approaches to expand more comprehensively with use of evidence-based health system strengthening strategies. Early and increasingly comprehensive TB public health interventions are win-win for displaced and host communities alike. Accessible and evidence-based TB services support household resiliency by preventing the potential for disabling and sometimes catastrophic illness. Families are able to focus on what matters most, such as education, livelihoods, and a hopeful future. At CDC, we look forward to using this field guide in our engagement with not only national TB programs and humanitarian organizations, but also public health emergency preparedness partners who play an important role in supporting TB service continuity. My hope is that it can support coordination across the humanitarian development nexus and bring a welcome set of common goals in planning TB services from an initial to comprehensive response. As you use this guide, we always welcome your feedback, including further partnership efforts to evaluate and disseminate best practices. Thank you to everyone for joining today. I'm honored to be here along with CDC colleagues. Monica, I'm ready to roll up my sleeves and get to work with this new field guide. Back to you.
Thank you so much, Kevin. Again, very clear actions on how CDC, what steps you will take to roll out the guide, of course, in partnership with us all. So excited to see the commitment and dedication that all of you can see. You heard from UNHCR, from CDC. Now we'll turn, and also, of course, from the country. Now we turn to our WHO colleague here, Dr. Rudy Connings from the Emergencies Department. Of course, we at the Global TB Program always promoting TB, and it's great to have Rudy here from the Emergencies Department. Rudy, we'd like to hear from you from the emergencies perspective. What do you see as WHO's role and key actions and opportunities that can be leveraged to roll out this guide and to reach those most in need? Over to you, Rudy.
Thank you very much, Monica, and welcome to all the partners, participants at this webinar. The World Health Department, the Emergency Department, is really pleased that we finally get the guide out. And with the events unfolding in Ukraine today, it could not have been more timely. Because when emergencies happen, the WHO Emergency Department kicks into action and does that by monitoring this health situation, identifying the health problems, and to provide essential services and supplies. And I was in the corridor just this morning. I met our logistics person, and I said, well, I'm sure you're preparing a few trucks to go to the east. He says, what do you mean trucks? Plane loads full of material. I said, I hope you have also TB prevention and treatment materials on these trucks and planes that will be going east. Because in the emergency department, we are working in 63 different countries, in Yemen, in South Sudan, in Somalia, Nigeria, Congo, just to name a few of the largest emergencies we are dealing with right now. And we know that when people are on the move, tuberculosis moves with them. And I have seen this personally when I was a young doctor assisting Cambodian refugees in Thailand, managing a TB control program as a young doctor. And it is I vividly remember still the days when you have a patient walking into your clinic and the patient is dying and you can see on his face. And 6 months later, this patient has gained 10 kilos and talks to you about his plans of the future. And you realize, I can make a difference. We can treat this disease. We can make a difference in the real life of real people. I wish I had had the guide. That would have been much more easier for me to do so. But now that we have the guide, I can only highly recommend that we use that in these situations, because we estimate that in 2020, because we have to review these data soon, 82.4 million people are displaced. High Commissioner informed us yesterday, High Commissioner for Refugees, that 700,000 people are on the move in Ukraine today. We know there is an incidence rate of 73 per 100,000. So we can expect a number of patients or potential TB patients among them. And that's where this guide will come in handy, because if we want to implement our vision of a world free of tuberculosis, we need to draw attention to this problem and also to the solutions we have, because we do have solutions. And that's what the Health Emergency Department is planning to do, to be prepared, as you can read in chapter 3 of the guide, to make sure tuberculosis is recognized early and treated promptly, and make sure that people who are under treatment and come in continue their treatment. And that's what we did, not only in refugee situations, but in situations like after Typhoon Haiyan in the Philippines, where lots of people were displaced. And for refugees, we know UNHCR and IOM did this for refugees from Syria coming into Jordan. You have to go out and ask for it. Many people in emergencies do not realize that tuberculosis is actually a fairly urgent problem. Because they think, oh, it's long term. No, we really have to make sure we treat them when we can at every opportunity. So we are prepared, make sure that we know that this is a problem and are attentive to it and respond. And our department does get involved in the response, and TB treatments are part of the package of essential services that we provide to all. And we do so in collaboration with, for example, the Ministry of Health in Bangladesh. All this is outlined in chapter 4. So for our department, we want to make sure that tuberculosis prevention and treatment remains high on our agenda in all the emergency programs that we work in, so that together we can end TB and leave no one behind. And this, the guide, I really hope, will be able to do so. Thank you.
Thank you so much for that, Rudy. Yeah, so thanks. It's really good to hear your personal experience and also, the experience you've had in countries, and also the commitment that is part of WHO emergencies, the whole effort. I mean, you rightly pointed out, as trucks are leaving to support people in conflict areas right now. I mean, hopefully TB prevention and care services are also on the list. So definitely something that's important and vital. So thanks for that, Rudy. We now turn to our WHO Civil Society Task Force member, Paran Sarimita Vinarni. She is a TB survivor herself and a passionate advocate on ending TB, and she leads a lot of work in Indonesia as well, including on youth engagement. So Paran, thank you for joining us. Could you put your video on, please?
Hi, Monica. Thank you so much. So sorry, I already sent you a message that I'm having a problem with my network in here like yesterday. So I'm
Okay.
trying to, yeah. So I cannot open
No problem, Paran. Don't worry about it. As long as we hear you, I think we are good. So thank you for joining us, Paran. And we look to hear from you on what you see as civil society perspectives on the need for translating this guide to action in a refugee and humanitarian context. The perspectives both from the task force, WHO Civil Society Task Force, as well as from yourself to ensure that no one is left behind. So over to you, Paran.
Okay, thank you, Monica. Greetings, everyone, ladies and gentlemen. First of all, I'd like to thank to WHO, United Nations High Commissioner for Refugee and CDC for giving me an opportunity to speak in this very important event on behalf of the Civil Society Task Force on TB and Youth 1+1 Initiative. My name is Paran Sarimita Winarni. I'm from Indonesia, one of countries with the highest TB, MDR-TB, and TB-HIV burden. I survived from TB twice, and since 2014, after being cured from GR-TB, I actively participate as a patient supporter for others who are fighting GR-TB in PETA, Jakarta. I'm also active in other global platforms such as WHO, Green Light Committee of Southeast Asia, Global Coalition of TB Activists, and TB CAP. As we already know, tuberculosis is one of the important global health burdens. It is also a major cause of mortality globally. One of the key risk population affected by tuberculosis are refugees, migrants, asylum seekers, and internally displaced people. These people have one big thing in common. They were forced to leave their homes due to national disaster, conflict, or they might be facing political or other challenges. The family units are also often separated. It is therefore very important that this new guidance is specifically looking at this population. This group often have very little economic means. They often travel large distance and have stressful psychosocial circumstances. Their journey often comes pure nutrition and other contacts, which makes them particularly vulnerable to TB, such as poor living standards in congested space. We also know that gender plays an important role. Women and children are particularly vulnerable, as well as very young and very old who are forced to leave their homes. While these persons may be from different socio-economic backgrounds and different reasons for fleeing or migrating and different legal status, many of these individuals face a high risk of tuberculosis, which may be emphasized by adverse conditions endured during their journey. I already touched upon. In case when they usually come from countries where different communicable diseases are endemic, they often receive minimal medical care and face challenges in access to health even prior to departure. In 2021, celebrating World TB Day, Youth Movement of Indonesia for Tuberculosis or IMUD collaborate with CIMSA, Center of Indonesia Medical Students Activities, to raise public awareness about TB and provide an event in raising tuberculosis awareness among refugees in Indonesia. We found that these people very much lack information about TB. how they can access the TB treatment if they have the symptoms, and also have poor access to information to TB treatment and prevention. Based on this activity, we decided to continue our work for raising TB awareness for refugees in Jakarta in the future. Within the civil society task force on TB, we focus on the issues that migrants and refugees face. My colleague from Thailand, ensuring access to TB services for refugees in the cross-border areas between Thailand and Myanmar. More than 9,000 people have been displaced as a result of armed conflict in the area since December 2021. As leading CSO providing care for migrants in Thailand, NIAN, and World Vision supported TB and COVID-19 vaccination, provide home isolation for COVID-19 positive, and establish temporary shelter and provide food and COVID-19 personal protective equipment to refugees together with the Royal Thai Army and provincial border. For existing old refugees who fled from Myanmar last 20 years ago are also still there. And their population is about like 90,000 people. But their health services, including TB services, are covered by the International Refugee Committee and some international NGOs. So just as this example shows, the health services for migrants, internally displaced, and refugees have heavily rely on action by the relevant UN, United Nations agencies such as Delegation International Organization of Migration, United Nations High Commissioner for Refugees, and others, as well as Red Cross and NGOs. We are very pleased that this Interagency field guide is being launched, and we call on all organizations and agencies providing care for this critical population to ensure systematic screening, diagnosis, treatment, and care for TB. Thank you for listening.
Thank you so much, Paran, for sharing your experience, for sharing the experience of other civil society task force members, and also um, sharing a statement of support and calling for action on this very important issue. Thank you, Paran. So we're going to take maybe a few minutes to take any questions that you may have before we close the panel. So looking at the Q&A, we see that there's one question on what could the role of national parliamentarians be in the implementation and accountability of the interagency field guide. So for this response, so we'll turn from WHO's side, I'll turn to Dr. Teresa Kasaeva, Director of the Global TB Program, and from UNHCR, Anne Burton. So to start with, Teresa, would you like to respond, please?
Yes, thank you very much, dear colleagues. This is a very important question and shows how informed is our audience and prepared. Definitely parliamentarians as well as other stakeholders can play an extremely important role. Specifically, parliamentarians could be drivers and facilitators of many processes. And in principle, what is the most important? To reflect and fix commitments and the clear actions in the legal documents, in the national strategies, plans and guidelines, and support them by financing needed for their implementation. So, and parliamentarians, due to the nature of their work, could be extremely important. So, and also engage civil society, of course, and other stakeholders. In general, our work on addressing a problem of refugees and other population in the humanitarian setting with TB reflects our deep belief and understanding that only through multi-sectoral actions we can address such a complex problems, especially in these the most vulnerable groups as refugees and others in humanitarian settings. Over.
Thank you so much, Teresa. Indeed, parliamentarians play a very vital role. I'll now turn to Anne Burton. Anne, would you like to take this question?
Yes, thank you very much. And I would also like to thank the person that actually asked the question. It's very, very relevant. I'll be very brief because I think Teresa covered most of the points, but just to highlight again the importance of a supportive policy environment. So that is in particular in relation to the guidance, actually having TB included in emergency preparedness plans. So the role of a parliamentarian is to advocate for this, to raise the importance amongst their constituencies as well as other fellow parliamentarians. And to really aim for a public health approach to TB. Secondly is to include emergencies in the national TB strategic plan. We know that communicable diseases, so that these populations are included, so that it's one national plan, but adapted to the needs of different populations. So we know that communicable diseases in particular don't know any boundaries, and so one inclusive plan that reaches all is going to be the most effective. And then lastly is into including the most vulnerable into national social protection schemes, including those with TB. But then favourable policies are the first step. It doesn't end there. So in terms of accountability, parliamentarians can actually support, can monitor, can ask questions to make sure that these, to support the relevant stakeholders to, and allocate resources so that these policies can be implemented. Thank you very much.
Thanks so much, Anne. Again, very clear about the need for parliamentarian support, in supporting policy development and getting the governance in place, supporting with accountability. So many thanks, Lucy Foster, for the question. If you do have any questions, my colleagues have put their emails in. Please do. As all of us have said, we're really open to your feedback, to your questions. I see in the chat that Jose Maria Garcia, also a member of the Spanish Respiratory Society, has said he is happy to share his experience installing expert in refugee camps. Please do email us, Jose Maria. We would like to hear from you. You've also given us your email, so we'll be happy to reach out to you to hear your experience. So we'd like to now take 2 minutes to hear back from the audience. We have over 110 people still connected. Before we go to closing and before we hear back from all the panelists, maybe one final message. If we can go back to Slido, colleagues. So my colleague Anna is sharing her screen, and again, if you could scan the code, and we want to hear from you. Now, you've heard from all the partner agencies, from the country, from civil society. If you could tell us, what do you see in just one sentence as key priorities for reaching refugees and other populations in humanitarian settings with TB prevention and care services? So again, you can scan the code and enter slido.com, or we invite you to go on slido.com and put down the code, which is hashtag Refugee 2022. So if you can tell us what are your key priorities that you see in rolling out the guide, and what do you see as priorities for reaching these populations? Okay, so we see here flexibility and preparedness. Screening is a priority. That's good. Accountability, indeed. Very important. Thank you, colleagues, for sharing. This is important for us so that we can get your perspectives too. Okay, active case finding, coordination between healthcare and resettlement settings. Wow, you all are really giving us your responses. Thank you so much for being so proactive. We are noting each of these down. Of course, policies are quite important. Cross-border, indeed, a big challenge. So we need to make sure that the correct interventions and the correct linkages are in place. Having access to primary services, linking that back. Education, cultural sensitivity, human resources. No, wonderful. Great suggestions from you all. We're going to keep this poll open. TB preventive treatment is quite important, of course. So we're going to keep this poll open, and we'll ask that you please continue posting. It's really good to see your interactivity, and we will collate all of these as your inputs as we plan to roll out the guide. So thank you. Please do keep it coming. So while we won't be sharing this on the screen, it's still available on slido.com. So please do continue posting what you see as key priorities. So to round off the panel, I'm going to go back again now to our panelists. I'll start with Dr. Kaswa. And I'll ask each of the panelists in maybe just one sentence, in a few seconds, if you can say, what do you see as the top priority in the rollout of this guide and reaching refugees and people in other humanitarian settings? So let's start with Dr. Kaswa. Dr. Kaswa, what do you see as the top priority?
Thank you, Monica. I guess all people have said the same. Huh? I think active case finding, using the several approach, starting by screening and get people and give them the opportunity to have diagnostic and also treatment, I guess is one of the top priorities. Look at from the side of healthcare. But it's true that make peace could be one of to avoid this kind of situation. So what I can say, thank you.
Thank you so much, Dr. Kaswa. I'll actually then jump to Paran. Paran, what do you see as civil society and our conscience and our voice? What do you see as the top priority, Paran?
Okay, thank you, Monica. From Civil Society Task Force, we have like three, the important one. The first one is global action and close collaboration with between WHO and agencies working on securing health services for the migrant and refugee to ensure TB is integrated in the response as vulnerability. And the second one is commitment by national programs to establish collaboration with the agencies and organization working with the local refugees and migrants. And the last one, civil society advocacy to make sure these key population are not left behind. That's from me and Civil Society Task Force.
Wonderful. Thank you so much, Paran. Very clear ask. Collaboration across agencies, making sure the NTP is working on this issue is part of the whole group working on the issue, and of course, civil society advocacy to push all of this. Okay, let's now turn to Anne Burton from UNHCR. Anne, over to you. What do you see as a top priority?
Yeah, thank you very much, Monica. Just very briefly, I think the top priorities, certainly I agree with everything that's been said before me, but just to add preparedness and flexibility. It's important for national TB programs when they're looking at preparedness to consider a range of scenarios and ensure that they have in place supportive policies and strategies that means that they can pivot the response to meet the needs of humanitarian populations, so that they can stay on treatment and continue treatment as well as get the diagnosis and support that they need. Thank you very much.
Thank you very much, Anne. Again, very clear points. Okay, let's turn to Kevin from CDC. Kevin?
Thank you. I think a top priority for us all will be accountability. There's, I think something in this field guide for everyone to take action on. And as Rudy had mentioned earlier, we collectively must resist past tendencies to view TB as an issue for another day or another partner. And the time is opportune as we mark World TB Day later this month. This is a great line of effort to hold ourselves and all stakeholders accountable to the role we can play in ending TB.
Thank you so much, Kevin. Indeed, opportune time. Rudy, over to you.
Thank you. And it's actually there. And I'm addressing my talk to the emergency people is to make sure to include tuberculosis planning in the emergency preparedness and response planning, which is not always the case. And we should make a commitment that no person should die from tuberculosis because they are forced to be on the move for whatever reason. So if we can make that commitment, include that in our planning, then I think we have made progress today.
Thank you so much, Rudy. Very passionate and clear call indeed needs to be prioritized. So without further ado, I'd like to thank all the panelists and speakers, and I'd like to turn to our director, Dr. Teresa Kasayeva, for the Global TB Program to deliver her closing remarks. Thank you so much.
So thank you very much, Monica, dear distinguished colleagues, partners, and friends. Before I will share a few words, closing words at the end of this very important event, I would suggest to take a minute of silence to commemorate those millions and even thousands now in different parts of the world who are still losing their lives due to numerous hardships in the conflict areas, humanitarian setting, and including due to TB. Thank you very much, dear colleagues. Today's discussion and dialogue, as I thought, is an important event, and it was very inspiring and productive discussions. And now we are all together looking forward to prioritize the needs of refugees and other populations in humanitarian settings to ensure that they are not left behind in assessing life-saving TB prevention, care, and other services. You may ask why now, why TB, and why we need this guide. And I hope that the response is quite clear. It's timely now, I believe, because of numerous reasons. So you see that people are continuing suffering, and unfortunately this number is growing due to the reasons we can see, and despite of all our efforts. But we can do much more to protect them, to save their lives, and that's why it's timely, and it gives us excellent opportunities to unite our forces, not only across WHO, across other agencies, and engage all relevant partners. Why TB, you will ask? We have multiple diseases. TB is so-called old chronic disease, but TB, as we learned from the history, always accompanying the conflicts, all the sufferings and problems in the humanitarian settings, and a socioeconomic crisis, and also then we'll have very clear and long-lasting circumstances and sequelae. So that's why these issues should be addressed immediately without further delay. Why we need guide, you will ask. You maybe we need just act and do our best, but I strongly believe that this guide will help to provide reasonable joint actions if we would like to see clear impact. So that's why I would like to encourage you to be involved actively, learn from this guide, and to provide urgent implementation. And also it shows how effectively we can work all together. And for the UN organization, in the current period of time, it's absolutely critical. And we should urgently respond, and response should be clear, meaningful, and implemented as soon as possible, especially when it's related to addressing needs of the most vulnerable groups. And as I told, I would like to thank colleagues from WHO, from emergency team, and other teams from UNHCR, from CDC, civil society representatives, and all other partners who contributed. It could be, by the way, also a good example and model how to address other disease-specific issues in these extremely important groups. The health of millions of refugees and population in humanitarian setting rests in our hands, especially now with conflict in several parts of the world, from what is happening in Eastern Europe to the African region to the Middle East. This is a huge responsibility. We cannot let them down. We need to keep our foot on the pedal by implementing the guide as rapidly as possible. By working together and showing joint leadership across efforts, we can ensure adequate care for those most in need and those most vulnerable. Together, we can ensure no one is left behind. I would like, at the end, to thank all the frontline workers and their heroes, real heroes, addressing for more than 2 years COVID issues, especially working in the most difficult humanitarian setting, and from civil society, our community health workers, for their huge contribution, vital contribution to address these issues. We need to keep our promises. We need to keep the world safe and protect the most vulnerable. There is not a moment to lose. Together, we can end suffering and death of people. Together, we can end TB. Thank you very much.
Thank you, everyone. Bye-bye.
Bye.
Thank you very much.
Thank you.
Thank you.